I learned about just places I could pitch stories to. And all of that is very exciting because I'm expanding my new freelance career. And from my other sessions, I got a ton of story ideas. And this is what I love about this conference. I mean, I always come away just excited about the beat, re-energized, and I'm hoping all of you are too. And for me, that's super important because last October 7th, I quit my job. And it is a full-time, well-paying job as healthcare correspondent for Southern California Public Radio, KPCC in Pasadena. And I quit it for a freelancing career. And the main reason was because I really love this beat, and I wanted to go deeper in a way that I just couldn't where I was. So I kind of grew out of that, and it's time to put on my big girl panties and be here. So here I am. But I was totally scared when I was, contemplating taking the leap. And it took me about 8 months to, grow the cojones I needed to do this. And, I really struggled with the idea. And I'm really glad I did it, but I couldn't have done it without the support of the Association of Healthcare Journalists. During the past 5 years I've been a member, I've gotten so much support from this organization. And I'm not going to start from the beginning because that was like 30 years ago, but that I started my career. But in late 2011, I landed this job as healthcare reporter for KPCC. And I applied for this healthcare reporting gig, not because I knew anything about health policy, because I so didn't. I knew nothing. I applied for it because I knew I could make it a gig where I could not be at the mothership in Pasadena and I could be at my home in Ojai, California. And so it was just totally self-serving. And so I was really excited about it. I landed it and I started getting into it and I'm like, oh my God. Nobody knew that healthcare was so complicated. And now you all know where Trump got that ridiculous quote from me. So, but seriously, it is so complicated. And I was sitting there like, Medicare, Medicaid, like what's the difference? And PPOs and HMOs, and then this new thing called an EPO. And I'm like, oh my God. And then the 1332, state innovation waivers. I'm like, oh, this is kind of tough. So when you're new to the beat and you have to speak on the air with authority, like you really know what you're talking about, and no one in your newsroom can help you because they don't know and they're just so glad they don't have that beat, it's super duper scary. You've all been there. And so I'm like not knowing what I'm doing. And then I heard about this group. And I'm like, well, that sounds like something I should go to. I don't even know how I convinced my editors to let me go because I do not like fellowships. So I was able to convince them, and I came away like energized like I am today. And so I wanted to tell you about a few of the things I've received from this amazing organization. Number one is the annual conference. So my first one was in Atlanta in 2012. And I always say it's there that I drank the Kool-Aid, and I fell in love with health policy. So no longer was it like a means to an end to live in a small town away from the mothership. It was like, I love this beat. And I felt like I was, for the first time in my career, honest to God, I felt like I was actually making a difference. Like the stories I did would make a difference. And that just meant everything to me because we all get into this business, I think, to make a difference. And then we work along and we're like, we're not making a difference sometimes. And this beat, we are. So that was great. And then there was all these books there and stuff, and I brought every one of them, and I read on the plane and just read and read and read and read. And I found myself on weekends, like reading about Medicare and Medicaid and loving it. And so that allowed me to cover the Supreme Court ruling, and I had to go on the air, and I knew what I was talking about, which was amazed me. And then I think it was 2013 or 2014, Ev, I don't remember, but I got one of the regional fellowships, and that was great. There's my table of fellows. Hello. And so we got to go on all these field trips and learn some more. San Francisco, Portland, Columbia, Missouri for a boot camp. They pay your way to the annual conference, and it was just fabulous. I learned so much. And then this year, as a freelancer, I was able to take advantage of the financial help that they give to, like fellows for this event. And that was super duper helpful. And here I am all excited about my story ideas. And throughout the year, there's webinars. I'm just telling you guys, because those of you who don't know about it, you really need to get on the website. You'll find tips for reporting. You'll find all these stories that some are about the basics of health policy and healthcare. Some are like nuanced things, just really, really good stuff. Great writing by great reporters. And then there's the free access to journals and databases. And then there's the people of this organization. And I see Charlie Ornstein and Ivan Oransky and Gideon Gill and Carl Stark and Jeff Porter, just some of the people that I used to like go to. You know, they say there's no such thing as a stupid question. There is, and I asked a bunch of them. But these guys were also, and women, were also, you know, helpful and generous with time. Like, everybody wants you to do well. And so you don't have to feel embarrassed about asking stupid questions. And again, you know, having this resource, like we don't have people, most of us in our newsrooms, who we can go to and get help from, but we have them here. Of course, right now, it's more important than maybe it's ever been. Because the first, you know, ACA 1.0, you know, no one was really, like, the public was not that interested. They didn't quite know what was up. And now everybody is interested. So they really need the work that you're doing. And you need to be accurate, and you have to simplify stuff. So this organization will help you do that.